Antihistamines are histamine receptor antagonists commonly used to treat allergic reactions caused by the release of histamine. Histamine is a biogenic amine and a classical neurotransmitter with an organic base that is present in all tissues, but is present in high concentrations in the lungs, skin, and gastrointestinal tract. Histamine is localized in mast cells, basophils or white blood cells, ECL or enterochromaffin-like cells in the gut, and in histaminergic neurons in the CNS. An allergy occurs when the body recognizes a normally innocuous substance to be harmful. These substances, such as bee stings, some drugs, food, dust mites, fur, or pollen, are known as allergens, which contain protein markers or antigens on their cell surface that are recognized by immune cells as being foreign. On initial exposure to an allergen, antigens are presented to T cells, which activate B cells to release IgE antibodies against the antigen, which attach themselves to the mast cells, creating an immunological memory to prepare the immune system for its next interaction with that same allergen. Upon second exposure to the allergen, antigens bind to the IgE antibodies, triggering the mast cells to degranulate and release mediators of inflammation, including histamine. When histamine is released from the mast cells, it binds to G protein-coupled receptors located on nearby cells and surrounding tissues. This causes dilation of nearby blood vessels, increasing their permeability, resulting in swelling and secretion of excess fluid, which leads to symptoms of allergic rhinitis such as nasal stuffiness, sneezing, runny nose, and watery eyes. Antihistamines protect cells from some of the allergic effects caused by histamine by blocking the action of histamine at its receptors. H1 antihistamines are commonly used to treat hay fever, reddening and wheal, as well as itching of the skin by blocking H1 receptors located in the nose, on blood vessels, and in the sensory nerves, respectively. They are also used to treat emesis, otherwise known as vomiting, from motion sickness or morning sickness by blocking H1 receptors located on the vestibular nuclei, thus blocking transmission of information to the chemoreceptor trigger zone, and the CNS and vomiting center. H2 antihistamines are clinically used to treat peptic ulcers caused by gastric acid secretion by blocking histamine from binding to the H2 receptors located on ECL or enterochromaffin-like cells in the stomach, thereby reducing gastric acid secretion and preventing further formation of peptic ulcers. Although they are still in the early stages of clinical trials, H3 antihistamines could potentially treat obesity, ADD, cognitive disorders, narcolepsy, and pain, while H4 receptors could modulate immune function by targeting H4 receptors on leukocytes.
Although antihistamines have many therapeutic benefits, they also have known side effects. These side effects, however, are dependent on the antihistamine drug's site of action, the person's level of sensitivity to the drug, and whether the person is taking any other medication that can lead to an increase in the severity of the side effect. Although Natasha mentioned that there are 4 types of histamine receptors, I will only be talking about the 2 most commonly treated histamine receptors, which are the H1 and H2 receptors, as little is known about the side effects and drug interactions with H3 and H4. H1 antihistamine drugs can be classed as either first or second generation, depending upon their effect on the CNS. First generation antihistamines, such as diphenhydramine, which is commonly known as Benadryl, are potent competitive inhibitors of the muscarinic receptors, causing cholinergic activity, resulting in dry mouth, blurry vision, and urinary retention. Also, due to their high lipophilicity, allowing them to cross the blood-brain barrier, they have an effect on the CNS, causing a sedative effect, like drowsiness and confusion. If taken in the presence of other drugs or alcohol, first-generation H1 antihistamines can cause further sedative effects such as depression and can alter the metabolism of the other drugs such as codeine, blocking codeine's effect. Second-generation H1 antihistamines like loratadine commonly known as claritine, have low affinity at muscarinic receptors, thus have no sedative effect, but are seen to act by inhibiting mast cell activation, inhibiting the inflammatory response altogether. Thus, this is why there are little to no side effects seen with the use of second-generation H1 antihistamines. However, second-generation H1 antihistamine drugs are metabolized by heptic enzymes, which, in the presence of other drugs, causes interference. Finally, H2 antihistamines, which act by blocking gastric acid secretion, are known well-tolerated medications for the treatment of peptic ulcers and heartburn. They are commonly used as they do not produce major side effects, but minor side effects such as constipation, drowsiness, and fatigue. However, as H2 antihistamines are also metabolized in the liver, in the presence of other drugs, this can cause drug interference, which prevents the other drugs from acting. This has been a Tash and Montana production.